Hello everyone, my name is Kimberly Gonzalez and I will be going over the Never event that occurred at Torrance Memorial Medical Center in 2011. I do want to preface by saying the news story regarding Torrance Memorial is not technically a Never event, since, as I will explain, the story involves a breach of patient privacy, which isn't covered under the definition of a Never event. However, the mindset, current standard at the time, and subsequent setting allowed for an event to happen that should have never happened. So let's move on to the news story. In October 2011, an OR material coordinator was going into surgery for a finger injury. Said patient was an employee at Torrance Memorial for 13 years and was well acquainted with the anesthesiologist, Dr. Patrick Young, and the nursing team. Toward the end of the surgery, Dr. Young thought the patient would get a kick out of receiving a fake mustache and teardrop under the left eye while unconscious. So, Dr. Young created the images, placed them on the patient, and asked the nurse, Patricia Gomez, to take a picture. When the patient awoke, they were shown a picture of them unconscious with the stickers on their face. The patient quickly felt humiliated and filed a civil lawsuit against Dr. Young, his medical practice, and the hospital for breaches of medical privacy. The civil lawsuit escalated to a state investigation on the matter. Torrance Memorial did claim that a lack of professionalism was shown and the familiarity of the patient led to poor judgment. However, in their statement, they did not condone or support the behavior of the team, no matter the familiarity. Dr. Yang, his medical group, and the nursing team were suspended for 2 weeks and were required to undergo internal behavioral training for the operating room staff. The patient, however, was very distraught by the situation. Their attorney, Andrew Ryan, stated there's no such thing as a joke in the operating room. For them to play a joke is cruel. I have not seen anything like this. It's an incredible breach of privacy, of HIPAA, of common decency, and of the Hippocratic Oath. He further goes on to say, it ruined my client's career of 13 years. The patient did not want to return to their job and quietly left Torrance Memorial. Dr. Deborah Peel, the founder of Patient Privacy Rights, a nonprofit advocacy group in Austin, Texas, stated the idea that people are using their cell phones or even have one in the operating room is crazy. It's a massive security risk and incredibly insensitive to patients. The situation re-earthed major concerns about hospitals' ability to ensure and protect patients' privacy. Many would like stricter laws and stricter government enforcements, especially regarding smartphones, which makes sharing data so easy. The option of allowing smartphones in the operating room, with the addition of a misguided thought process of a professional, unintentionally caused massive security risks that enabled this situation to occur. Additionally, this is not a singular event. There have been multiple situations similar to this case, such as the case of St. Mary Medical Center in Long Beach, when photos of a deceased patient were taken by the nursing staff. The situation, by definition, may not be considered a never event. However, it does not negate the fact that there was a gap in the system of care that was identifiable, preventable, and serious in consequences that reduce the safety and credibility of Torrance Memorial. Risk, as we all can agree, is something to prevent, not fixed in response to inaction or oversight. Unfortunately, this lesson had to be hard learned. These motives behind decreasing never events, yes, are partially due to continual payments of financial incentives. However, as healthcare professionals, we must always remember that a key element of care for a patient is trust. As this example has shown, if we do not actively seek ways to improve and reduce risk, we are at risk of breaking that patient's trust. This case was an example of an event that breached patient privacy, yet it also breached a patient's dignity, breaking that trust of care. Thank you for listening. Here are my references.